Hi, welcome to Best Nursing Home Inspections. And we're here doing a series on finding the best nursing home and the best activities and anything else that pertain to you bringing your loved ones into a facility, or as a nurse trying to choose a facility that you can be proud to work on. And what we're going to start is just giving you good examples of what to look for. Now, my name is Kathy Johnson. I am an LPN. And next to me is Ellen Wall. And Ellen, would you please introduce yourself?
Well, I'd be happy to, Kathy. I'm Ellen Wolf. I'm a retired assisted living director. I was director for a number of years, and I also am Florida State certified for Alzheimer's care by the Elder Department here in Florida. So I volunteered my services to be a consultant since I have had many years of dealing with residents and having them being moved from an assisted living into a nursing center. And what I think we're going to start with is have different segments in our videos here, so that the first 10-minute one will be just what to look for with a nursing center for your loved one when you find the time has come. And we'll have a number of short little segments that you can turn into from time to time. It's just like exercising. You don't have to do 30 minutes at once. You can do 10 minutes 3 times a day and get the same effect.
Mm-hmm.
So that's what we're here to help you experiencing. You want to know how they take care of those patients, and are they separated from the general population, or are they intermingled?
Right. A lot of times they'll take Alzheimer's and put them on a special locked unit because Alzheimer's people tend to wander, especially at night. And it's very easy for one of them to wander off because they're just walking, and it's easy not to see them. They're not displaying a lot of times any unusual things. So I think that's very important. Well, if you think about hand washing and you've got, let's say, 40 patients. You've got to wash your hands before you go in. You take care of the person. You wash your hands when you go out. Sometimes you wash them in between.
And do you sing happy birthday twice when you're washing your hands to make sure you've got enough time to kill the germs?
So here's the deal. If you've got 40 patients and minimally you're in there once, that is, how long is happy birthday?
15? 20 seconds.
20 seconds. 20 times 40 times 2 is how many seconds? Doesn't seem like a lot. See, 20 times 2 is 160 times 2, 320. No, that's not right. Anyway, but it adds up, and it's something that and it is considered direct care because you're doing it right as you're coming in or going out, or sometimes you're in the room and you might have to even wash your hands, 2 or 3 times depending upon what type of procedure you're doing. And hand washing, amazingly enough, just that little tiny segment takes a good amount of time when you can multiplying it. So it's say 40 seconds times 40 people gets to be, I'm guessing, about 45 minutes of the nursing time just for that.
And you'll see a lot of times now that they have the hand sanitizer inside of the hospital rooms and the facility rooms, so they don't really wash their hands. They're going click, click like this.
But still, this needs to take a little time. And the recommendations are to only use that little thing, I think 2 or 3 times before you then again go wash your hands.
It's okay. That's a good point.
Wash your hands before you put gloves on. Wash them when you take your gloves off. It's just a lot. So, but I mean, not to get all into hand washing. When you look at comparegovernment.com, you're going to notice nursing hours, LPN, RN, and C.N.A. What you're not seeing is the difference between direct care and indirect care. So if you're saying to yourself, oh, there's 30 people on this floor, and I'm going to have one nurse 4 hours, let's say 16 hours of C.N.A. care, which would be really high. But you can effectively cut that time in half. And when you do that, you're going to say, oh, if I had this total 3.5 hours care. You can cut it in half to an hour and 30 minutes because each side, the direct and indirect care, will take half of the nurse's time.